Hey, I'm back, even though this is like a continuation of my previous video, and I'm going to talk about the pathology and the kind of questions that I'm going to ask my oncologist when I see him. There's genetic testing for what's called the BRCA1 and 2 and also BALB2 genes. BALB2 is, I think, associated more with ovarian cancer. One of the other questions I have, because since I have one cancer, I would like to know if there is a chance that I have cancer elsewhere in my body, whether that's ovarian, whether that's it can travel to your bones, it can travel to your liver, it can be active right now, or it can lay dormant and then it can kind of activate, so to speak, later on. So I'm going to ask him if I need to see any other doctors, like a gynecologist, what kind of other tests I need to have done, if they will be testing me to make sure that it would be really nice, just for my peace of mind to know that, no, I don't have cancer anywhere else. This is it. We're just dealing with this for right now. That would be amazing. There's also a question about like making sure that if I need like reconstruction and implants and all of that, if my insurance is going to cover that. Now, by law, in 1998, a law was passed saying that insurances have to cover breast reconstruction from cancer. And I'm not sure if that includes if women, there's different procedures. You can have reconstruction with or without implants, and there's like a flap technique and all of that. There is a question as to whether government insurances like Medi-Cal, Medicaid, and Medicare cover it. My tests say that I'm HER2 negative, which I read to believe that means that the cancer is not a fast-growing cancer. So if that's true, that would be amazing as well. There is also a point of when you first find out that you're diagnosed with cancer, you feel like you want to like go in and attack it aggressively, like see the doctor right away and like get things going. What's more important is finding the right doctor. You can go and get second and third opinions. Insurance will usually cover at least second opinions. And make sure you have a doctor you're comfortable with that considers your feelings, your perspective, your quality of life, and will work with you on your course of treatments. I will tell you that personally, I really don't want to, this is going to sound really funny, I'm probably more concerned about, and don't judge me, losing my hair than losing my breasts. Because in my head, I'm like, well, the breast can be reconstructed, but I've had waist-length hair for 15 years. It's kind of an identifying thing to me. Men don't understand. My dad were like, it's just hair. It's not your life. I'm like, I know that, but I need you to also be supportive of how I'm feeling about this, because I've had nightmares about losing my hair and going into sheer panic because I feel naked without it. I really hope I don't need chemotherapy, is pretty much where I'm going with that. So you want to ask about like risks and side effects to the treatments they suggest. They can estimate from other blood tests and from what your pathology results say, they can actually give you a percentage estimate of your chance of reoccurrence. So I'm sure they'll automatically tell you about that, but I have everything written down. What would need to be done if it comes back, the positives and negatives to lumpectomy versus mastectomy. No matter what stage of breast cancer you have, they have to remove at least a couple lymph nodes to check to see if it's in there, because there's a higher risk of it spreading to the rest of your body. And then if it is in your lymph nodes, then again your treatment is different. I'm really hoping it's not in my lymph nodes. I'm also worried about having my lymph nodes removed because I'm a photographer, so holding my arms up in the air for hours is already tiring, and you can get lymphedema and swelling of your arm and hand, and I guess it can be pretty painful. there's just a lot of things to consider, and this is the journey of this. It's so long, and there's so much. So there's even different kinds of mastectomy, and one of them is nipple sparing, which means you get to keep your nipples, and then another one is they have to remove your nipples, which then I guess nipple reconstruction isn't that great, and they usually suggest getting like 3D tattooed nipples on, which I looked up, by the way, and they look amazing. It's kind of phenomenal, like if you get a really good artist. Well, I need to ask if I need to stop taking my birth control, because I take the birth control to help with my endometriosis pain and control that. I'm gonna ask if there's any like foods and other medications and stuff I would have to stop eating. Like I was really curious about soy products. I'm allergic to dairy, so I drink stuff like soy milk once in a while, and other soy products, and I read many things about how that increases or affects your estrogen, so that would be really interesting for me to know from an actual medical doctor if there's any weight to that. Another good question is, how often will I need to have like follow-up tests and scans done? If I can't take some of the medication that they're suggesting, then I may need to have scans done like once every 6 months instead of once a year. I guess we'll see. Obviously, I'm going to ask how big the tumor is exactly, because they can't tell from a biopsy and from I can't really tell. Now, I was negative for lymphatic / vascular drainage, which one of my questions is going to be, is that a good indicator that it has not traveled to my lymph nodes? Maybe getting like a rehabilitation therapist. Some women can probably use that depending on how much surgery they need, how many lymph nodes they have to take, to help increase your range of motion and like work back up to, because who knows when I'm going to be able to, after whatever surgery I have, how long it's going to be before I can actually move my arms and work again. So I'm also concerned about my photography career, how that will be affected. I have been a model since I was 13, and that was my main career and my living, how I made my living through my 20s and 30s. And in my 30s, I started thinking, okay, well, modeling has a shelf life. You can't do that forever. So I had to think about what I was going to do next for a career, and I wanted to do that while I was still modeling. So I started transitioning into photography. So I've had a photography business. I specialize in acting headshots, and I do band photography. So I've been doing that for about 5 years. I'm still modeling, just not as much as I used to, and because very fortunately, I don't look 42. I just have taken really good care of my skin and my body since I was a kid, because that was kind of my job to do so. So fortunately, my modeling career lasted a lot longer than I was expecting at all. I thought I would be like ancient and done when I hit 30. And fortunately, I've been able to do it much longer. I would at least love to still be successful in my photography career. That would be nice. Oh, and my dad, by the way, also likes to pat himself on the back for my fantastic genetics. I'm sure my mother has something to say about that. My appointment isn't for another, like almost 3 weeks. So now it's just kind of getting organized. You want to have all your doctors written down, their phone numbers, their addresses, dates of surgery. There's all this paperwork to fill out. You want to have all your scans together. You want to have just copies of everything for yourself, and then if you have to hand over to the doctors as well. So you pretty much want all information that you can possibly have so that you can be prepared for whatever they may want or need. I would like this to be handled. It's all really rough. And I'm really sorry if you're going through this too. I certainly did not expect that to happen to me right now, and especially since I don't have any risk factors. I was never a drinker or a smoker, or, I mean, these are all considered risk factors. The only risk factor I had was because of the endometriosis when I was 17, I was put on birth control. But you don't know. There's no way to know. I hope that these videos are helpful, and I hope that you have someone, if you have this too, someone that's there. Lean on the people that love you. It was really hard telling my family and friends. And now I'm telling everyone, so I just hope that I know that I can get through this. I've gotten through everything else, and you can get through this. And everything might not be okay. Always, but that's life, I guess. So I wish you luck, and I will see you soon.